Hello, I'm Chun Sang Park, a prosthetic urologist practicing in Seoul, South Korea. My practice is dedicated and focused on the penile implant surgery, especially inflatable. Today I'm going to talk about some of the questions I got from the patient. The first question was, function is most important, but I have lost size for numerous reasons. In case of like this, is both Coloplast and AMS available to me? Size is an important matter. Primary focus of the penile implant is to restoring erectile dysfunction. I get it. I got trained like that. I agree. However, what we have to think about is that whenever a man goes through an erectile dysfunction, and if the patient needs a penile implant, it means that he has been on erectile dysfunction for a long time. So if ED goes on like that, patient will lose their size over the time. Patients who had a radical prostatectomy, after about a year later, they will lose about an inch if they become impotent. So restoring size, if we can, is a kind of important thing. Most of the Western countries, and especially in the US, good portion of the more than 95 or more than that percent of cases will be done with an insurance. So those patients who can be covered with the insurance will get the surgery. But in here, in my country, South Korea, there's no insurance for the penile implant. Every single case done in my country with the penile implant is a cash patient. They are not covered by the insurance. Because of that, I believe, when I told my patients that the way I trained in the US, after this surgery, you will lose your size, patients were not very happy. I mean, they couldn't understand in the beginning why they should get the surgery. I mean, same to me as well. If you think about that, you can restore your function, but you will have to give up a good portion of the size, it will be a very stressful situation. So my surgical method has been focused on how to restore the size. And I try to maximize the size as the best as I can. So most of the patients ask me questions like this. Doc, will I be able to restore the size I had after this surgery, after the penile implant, especially inflatable ones? I tell them that I don't know. I honestly don't know, because I couldn't see their size when they were not in erectile dysfunction, when they were young and healthy. Probably their size was much better than what they are right now. However, I do tell them that if you follow the method I tell you after the surgery, there's a good chance that you'll be able to restore the size about this much, about that much. So after the surgery, I measure the penile length and the corporal length and all the steps. I will tell my patients to count that in to restore the size over the time. So when doing this, the size of the penis matters. So think about this. Coloplast and AMS, both of them are good for just restoring the erectile dysfunction. They have no big differences. My mentor, Dr. Wilson, says that 97% of the cases, any implant actually will do just fine. But in a certain cases, like 3%, Peyronie disease or corporal issues, something like that, then either type of the implant will work better. That's what he taught me. This is only for the restoring the erection, not about the size. But when it comes to restoring a size, there comes some difference. So I gotta tell you that this is a completely anecdotal experience of mine. If the patient has a girthy and a pretty decent size of penis, then I believe Coloplast is somewhat better than the AMS. AMS, as you may know, the cylinders are very natural. They are very soft. While Coloplast has a more sturdier material, and it is much more thicker when it's fully inflated. So I think the pressure that can hold by the Coloplast cylinders are better than the AMS cylinders. That's why I prefer Coloplast one if the patient has a good size of the penis. It seems to work a little better than the AMS over the course of years. But if that's not the case, if the patient has a regular size of the penis, then both implants will just do fine. So it depends on how much stress the cylinders will be put on. Will be a good discerning point which implant will be better for the patient. So for me, I usually decided at the time of the surgery, because erectile penile size and the unerected penile size has a very huge differences. So hopefully this will give you some background to understand the penile implant. I'll talk about the other questions in upcoming videos.